Hello, my name is Padraig Hart and I'm a clinical scientist in the Regional Molecular Diagnostic Service of Belfast City Hospital. Genetics is the traits that we pass on to our children and grandchildren. Genes are what make us what we are and who we are, whether we're tall or short, whether we're smart or sporty. They can also determine what medical conditions we might have. Some of these medical conditions could be obvious, but others can remain hidden for years, only to surface unexpectedly as a result of a heart attack or a stroke. It's important that we identify people who have genetic conditions, and we do that as early as possible so that they can get treatment as early as possible. We get a copy of each of our genes from our parents. Normally, if we get a bad copy of a gene, we can compensate by having the normal one from the other parent. Unfortunately, with familial hypercholesterolemia, that isn't the case. This is known as dominant inheritance, where the pathogenic trait is dominant over the normal. And it means that if a parent has FH, then their child has a 50-50 chance of inheriting the variant and also being affected with FH. In rare cases, a patient may inherit two mutations. This can happen where both parents have FH and they each pass on the pathogenic variant to their child. This is known as homozygous FH, and it's considerably more serious and usually manifests in childhood. Genetic testing is important for two reasons. It informs the patient that they have a condition which relies largely on their taking their medication. It's unlikely that control of diet and lifestyle alone will be sufficient to control cholesterol levels if you have genetic familial hypercholesterolemia. It's also important because it facilitates testing of family members. FH can be treated very successfully, and the younger the people are treated, the better. More importantly, it allows the diagnosis of family members who may be affected without their being aware. And the earlier that we can find and identify those patients, the earlier they can be treated. In Northern Ireland, we're particularly good at this, and we treat and test on average 7 family members for each person who has been identified as having FH. Genetic testing involves the taking of a blood sample, usually at the same time as the sample is taken for measuring cholesterol levels. DNA is then extracted from the blood sample at the laboratory, and the lipid genes tested by DNA sequencing. The results of these tests are then fed back to the clinician or the FH nurse. The results are then reported back to the clinician, and if a pathogenic variant has been identified, then family testing can be offered. In Northern Ireland, we have been testing for familial hypercholesterolemia for a number of years and are the best performing centre for this in the United Kingdom. We have identified over 25% of the expected FH patients in the province, which is more than twice anyone else in the UK has done.